الشاشة كده. I'll talk about the Holy Grail for hematologic malignancies. At first, all of us know that cell homeostasis depends on the delicate control of the quality and the quantity of constituent protein, which is more critical in cells which have a high turnover rate. And this needs to synthesize and degrade proteins in an efficient manner. The proteolytic system in eukaryotic cells divided into endosomal lysosomal pathway, which degrade extracellular and cell surface proteins, the ubiquitin proteasomal pathway, which degrade intracellular proteins, and the mitochondria, which have its own proteolytic system. Specifically talking about the ubiquitin proteasomal pathway, it's the main non-lysosomal endoproteases enzyme complex in the cytoplasm and the nucleus, play a critical role in the degradation of intracellular proteins. It's formed of large hollow cylinder composed of 219S regulatory units on both ends and catalytic core 20S, which formed of 2 inner beta rings and 2 alpha rings and base ring on the bottom and top. The ubiquitin added sequentially to the growing chain of the protein of interest. It's called a polyubiquitination, which requires 3 enzyme activities: activating enzyme E1, conjugating enzyme E2, and the protein ligase E3. These processes induce protein unfolding by hydrolase, which enter the narrow gate of the 20 or catalytic core and degrade the protein. So the physiological proteasomal degradation started by the ubiquitin addition or activation by E1 enzyme, which transfer it to E2 enzyme. Then E3 ligase bind to E2 ubiquitin complex, allowing the ubiquitin transfer to the protein of interest. At that point, the protein of interest is ready to be degraded by the proteasomal system. When we added a linker between the protein of interest and E2, E3 ubiquitin complex, we can enhance the protein degradation. This linker is called PROTACs, which linker bind between the protein of interest and the ubiquitin E3 ligase, enhancing this protein of interest degradation. This is our holy grail for hematologic malignancies. So the proteolytic targeting chimeras are heterobifunctional small molecules that utilize the ubiquitin proteasomal system to degrade the protein of interest. They have the ability to target the undruggable or difficult to target proteins such as transcription factors to improve selectivity because of their unique mechanism of action. The bridging between the protein of interest and E3 ligase mediated by the PROTAC facilitates the ubiquitination of the protein and its proteasomal degradation. There is a significant progress has been made in the development of anti-tumor PROTACs over the last 20 years. And there are 4 main approaches to suppress the protein of interest: the conventional small molecule inhibitors, genetic manipulation like CRISPR, which is still under development and has several limitations due to its metabolic instability and off-target effects, and protein neutralization using monoclonal antibodies, and finally the protein degradation by PROTACs. So the PROTACs are novel, targeted, effective, and specific anti-cancer therapeutics in hematologic and non-hematologic malignancies. They produce longer and stronger biological effects than small molecule inhibitors, as they induce degradation rather than inhibition, allowing us to use less intense dose and less side effects. They also can overcome drug resistance resulting from mutation of the protein of interest or compensatory increase in this protein induced by small molecule inhibitors, and achieve selective degradation of the protein. The mechanism of action of PROTACs, one of them is called homoprotacs, which is developed by tethering to E3 ligase ligand with a linker to induce a self-degradation of the oncogenic E3 ligase like MDM2. The other mechanism is light controllable PROTACs, which is a photoremovable group is attached to either the protein of interest or E3 ligase or the linker when detached from the BRUTAC upon light irradiation, converting it into active BRUTAC. Some examples about the protein of interest targeted by the BRUTAC in hematologic malignancies, like anaplastic lymphoma kinase, which is a receptor tyrosine kinase activated in many cancers, in anaplastic large cell lymphoma, diffuse large B cell, and some solid tumors like non-small cell lung cancer. BCL2, which is important intrinsic mitochondrial mediated apoptotic pathways responsible for resistance in cancer therapies. BCL6, which involved in germinal center proliferation in the B cell, improving its proliferation and survival. BCR-ABL, which is an oncogenic protein, fusion protein, implicated in CML, despite that the tyrosine kinase is still the standard of care against BCL-ABL in CML patients. BTK is involved in active B-cell receptor signaling in various B-cell malignancies like CLL, diffuse large B-cell, and mantle cell lymphoma, while that ibrutinib is still the approved irreversible covalent BTK inhibitors. Cyclin DK6 is a member of cyclin-dependent kinases which regulate the cell cycle and cell proliferation and has a role in mixed lineage leukemia and Philadelphia positive ALL. FLT3, which play a major role in hematopoiesis regulation, mutated in many diseases, especially AML, and MDM2, which is a E3 ligase ubiquitin, is a powerful inhibitor of the tumor suppressor B53, and carreticulin mutation, which present in Philadelphia negative MBN. Histone deacetylase and the histone acetyl transferase, also nucleophosmine, which is one of the most commonly mutated genes in AML, occurring in 50% of adult and 20% of childhood AML. So our safety concerns about the BRUTACs, that it can deplete their target, which may be detrimental if the protein of interest is essential for the normal cell function, while a small molecule inhibitor just inhibit the protein of interest, which may be tolerable. Second is that some protein of interest have both enzymatic and scaffold function, which may be important for the normal cell function, while that BRUTAC can deplete both of the function, enzymatic and scaffold function, which has undesirable consequences. The prolonged depletion of the target protein by BRUTACs can cause toxic effects if the protein of interest is important in the cell function, and many BRUTACs not completely selective and can degrade protein other than desired one. Also, the ubiquitin system maintains the homeostasis of intracellular protein, and the BRUTACs can disrupt this homeostatic function. The formation of a stable complex between the protein of interest of BRUTACs and E3 ligase is essential for BRUTACs to induce degradation. However, high concentration of the BRUTACs can produce a hook effect, which lead to a binary complex of the BRUTACs and E3 ligase, which can recruit off-target and lead to degradation of the on-target and off-target proteins, leading to toxicity. Finally, there are many limitations for all drug modalities that target proteins, including BRUTAC, as we don't know how much protein is needed to be degraded to induce biological effects that don't depend on receptor occupancy. And to reduce this clinical toxicity, strategies should be developed to reduce the on-target and off-target toxicities of BRUTACs to induce more rapid introduction of the BRUTACs in clinical field. The first one is that if the targeted protein is widely expressed in non-transformed tissue, its degradation can produce serious on-target side effects when applied to the patient. Also, the E3 tissue specificity can be incorporated to reduce on-target dose limiting toxicity. An appropriate selection of the target protein and E3 ligase will not only increase the specificity, but also augment the effectiveness and reduce side effects. On the other hand, BRUTAC resistance can occur due to genetic alteration in the protein integrity of the ubiquitin or proteasomal system or E2 or E3 ligases. So, crucial aspect in the selection of protein can play a major oncogenic role in a certain tumor types. Optimization of the ligase used in the PROTACs design to specific tumor tissue or cell type, or vectorization of the compound with specific antibodies are strategies to be implemented. Selection of the best combination with other therapies could reduce side effects and augment the efficacy. And PROTACs not only limited to the cancer therapy, as they are used in any disease. In its pathology is the accumulation of the proteins in the cell, like neurodegenerative and autoimmune diseases, and in situation where the target has a scaffolding role that can't be inhibited by conventional inhibition or inhibitor, or form part of hard-to-drug target, PROTACs can play a central role. So finally, you can say that PROTACs offering hope. Thank you.